And as the coronavirus rages on, many doctors are concerned about the upcoming flu season, saying it could be a potentially dangerous double threat. If a patient were to contract both COVID and the flu, DX says it could also be difficult to diagnose an exact cause of death in many cases. Fox Carolina's Kayla Conboy joins us live tonight. And what is DX saying about even current space in hospitals, Kayla?
Well, some are nearing capacity, but with the survival rate increasing, a lot of patients are going home sooner, so they aren't taking up bed space for as long as, say, maybe they were 2 months ago.
There's a looming threat over healthcare workers, the dreaded flu, and mix that with COVID, and all eyes turn to the hospitals.
Been in contact with all the hospitals. We just had a couple of calls today with Tidelands and with Prisma. Tidelands has put in a resource request to E&D for staffing support.
Because doctors and nurses are already working around the clock, risking their own health to help others.
We are not to the point yet of looking at alternate facilities or any type of surge planning, but we started talking with the hospital pretty much on a daily basis last week as we were getting close to that.
Getting close to capacity for some, but DHEC says most hospitals started their own internal searches for staffing and outbuildings if it comes to that. And the threat of flu season also has medical facilities looking at their equipment.
We're also seeing some of our highest hospitalization rates and also the highest number of COVID-19 related patients that have required ventilators.
Which is another concern. DHEC is worried about COVID and the flu season overlapping, looking at how they could separate the patients so they don't contract both. And it's left the state wondering if there's enough equipment to go around. For now, they are in good shape, but they say things could change.
There are 1,939 ventilators, and there are 480 ventilators in use for a utilization rate of about 25%, and 172 of those 480 are being used by patients with COVID-19.
There have already been a few cases of the flu, and doctors do say they've seen some success stories as well, people surviving after having both the virus and the flu. Reporting live in Greenville, Kayla Conboy, Fox Carolina, the 10 o'clock news.